Well, now more than ever, mental health is a hot button issue. And if you or someone you know is struggling with a mental illness, getting help is nothing to be ashamed of. Joining us is Jill Merrell of the Merrell Family Foundation. And Jill has a very important message to share. And sadly, all of this is through tragedy that your family experienced. And I know you've been very thoughtful about being willing to share what happened that made you to say, no, it's time to do something about making mental health front and center in the community.
Oh, absolutely, and thank you so much, Rox. We really appreciate that. The media is allowing us to go ahead and have our voice, because mental health needs to be a conversation that everybody's having, and it needs to be as normal a conversation as you would with any other health initiative.
What happened with your family, and what would you experience so sadly that made you realize you had to reach out like this?
With us, my husband, who was the most outgoing, gregarious person that you met, he was the life of the party. We started to notice that he was becoming withdrawn. We thought it was age. We would speak with people that would say, oh yes, my husband too, when he gets to be, got to be a certain age, he became curmudgeon-y, and that was not at all John's personality. And it was when we realized it wasn't just that it was an age-related issue. We realized that something was seriously wrong, and he did not want to, the stigma attached to it, he did not want to go ahead and share it with people. So we reached out for resources, and we found it very difficult to find the ones that were able to help him.
But sadly, John ended his own life.
Yes, he did.
And thus, the foundation, you want to honor him. And what does the foundation offer to people who might be listening today and think, gee, my son or daughter's going through this. Oh, my husband's showing the same symptoms, or my wife is showing the same symptoms. What are those symptoms, and where can they go to get help?
Well, I think the biggest thing that people have to realize is that if you notice somebody's behavior has changed, don't think that they're just too busy or that they don't need you. Ask questions. If somebody that you know was always one way and they've changed, don't think that their life has become one that they don't need you. We need as a community to reach out to each other and at least ask the question, are you okay? Do you need anything? I'm here for you. It really, people think with social media and all these things that everybody's so busy and their life is so filled with so much going on, and that isn't always necessarily the case. So I think it's just talking to each other and being there.
It's just so hard for people to say, I'm okay when I'm not, because then there's the thing, you go to a doctor if you have a cold, you don't feel right emotionally, and it's hard to say that because of the stigma attached. What do we do to get rid of that? What's the first thing we as a community can do to say it's okay if you don't feel right in your heart or overall emotionally?
You sit here and you appreciate the fact that the community reaches out and wants to hear your message, and we're willing to share it, and everybody else has to be. If you had cancer, if you had heart disease, you would want to make sure that you're taking care of your heart so that you can stay healthy. And then when you start to have a problem, you'd want to go ahead and do things to go ahead and help it. And there are resources out there.
We have a link to the Merrell Family Foundation on our website in this As Seen on 5 section. What is offered through the foundation, very briefly, to people who might be getting in touch with you today? What can they be directed to?
There's stories and different research that's on there. In addition, there is resources where you go if you do have a mental health problem and you need to find help. In addition, our partnership with Palm Healthcare Foundation, on their website also, they have a lot of information.
So there's a wealth of information out there. You do not need to be embarrassed or feel badly if you don't feel well all over.
We all need to help each other.
We sure do. Thank you, Jill. We'll end it on that. Appreciate your time. Let's send things